Hi everyone, welcome back to my channel. So I look a little disheveled and a little bit out of it because this was kind of I want to say like a last minute video, which kind of doesn't make any sense. A spur of the moment video. There you go. Um, I had a moment here alone, and I really wanted to do this video because um, there's a lot of stuff that has just been very concerning to me that I've been seeing a lot on social media and just news reports and things like that, obviously related to COVID. Um, right now, there is a very disturbing trend of where I'm seeing a lot of well, not a lot, but I'm seeing some higher profile names talking about ivermectin. And this is the big buzzword right now. And of course, recently there was Joe Rogan, uh, who claimed that he had COVID, mentioned that as part of his treatment regimen. I'm not going to get into my own opinion as to whether I believe he was actually sick or not. The disturbing part is the fact that he had to throw out that buzzword as well as, this entire cocktail of drugs that he took. But of course, he had to throw in the ivermectin, which, like I said, is the buzzword of the moment. Um, and of course, I'm going to jump onto that bandwagon as well because it is the big buzzword of right now. And obviously, hey, I might get some views off of this. And that is, I'm going to flat out say that's the mentality of all of these people, these higher profile people that are talking about ivermectin. It's going to get attention because it's become such a hot topic. But I wanted to address this because, and again, I'm not a doctor. I have no medical background. My only experience is as a patient. Um, and as a patient that has taken medications, I don't want to say like ivermectin, but have taken medications that, for a very long time that can cause similar issues uh, that ivermectin can also cause. So I think what a lot of people have been seeing on social media is that ivermectin, and this was the same argument with hydroxychloroquine, and I probably did a video on that one last year. Now we've moved on to ivermectin. But the argument was that the drugs were being used in India and it was controlling COVID very well in India, and they didn't have as many, you know, fatalities as the United States. Um, the death rate in India, much like in the rest of the world, is very undercounted. Um, I think there are a lot of government leaders that are they want to make it look like things are going well. Our country is no exception to that. And, other countries, even Mexico, has been guilty of just underreporting. And I think, too, just because of the overwhelming amount of sick people, um, it just becomes very difficult to count how many actual deaths are occurring as a result of COVID-19. But that's how this whole ivermectin, hydroxychloroquine uh, fad, I guess, came to be. A lot of people believe that it's been working successfully in countries like India and that we should be doing that here. Now, the reason those countries are using these types of drugs is because they don't have vaccines. They are begging for vaccines. They wish that they had the amount of vaccines that we had, or that we have, because it's simpler and much more effective than ivermectin. Yes, there are some studies, studies that have been retracted. We don't need to get into that debate. Let's just pretend the studies are legit. There were studies that showed that it might be effective against COVID-19. So we can leave that on the table. And I think the arguing with people over this, and arguing with people that are saying it's not horse medicine, it's used in humans. Yes, it has been used in humans. It is actually used in the treatment of Lyme disease, and I think that's where people have I think some people might be familiar with it, they just don't know from where. It's used in the treatment for Lyme disease, and there are Lyme literate physicians that are actually prescribing these drugs to their patients right now for the treatment of COVID-19. I'm one of those patients. My doctor prescribed me hydroxychloroquine. Please do not ask me for the doctor's name or where I got the medication from, because I'm not going to hand out that information. And I will tell you why. And yeah, I know that there are other Lyme literate MDs. I spoke to one recently that does prescribe ivermectin for COVID-19. I'm also not going to give out his name. So here's the issue, and this is the part that I really want people to understand. And if it doesn't matter which side you're on, if you're trying to talk and reason with somebody over the whole ivermectin thing and telling them it's horse paste or whatever, I think people have already decided, what to believe. And you can't really talk someone out of it, especially when they believe that this is a political issue or this is some kind of conspiracy. Once people start believing in conspiracies, it's very difficult to talk them down from that. You really can't. But here is the thing. Think to yourself, if you're talking to someone that believes that ivermectin is the cure or whatever, here's the first question you should ask them. What is the protocol for ivermectin? And I'm asking you that question as well. What is the protocol for ivermectin? And if they start getting on their phone and Googling it, say, no. You need to tell me off the top of your head what the protocol is for ivermectin, for COVID-19 treatment with ivermectin. And I can guarantee you the person is not going to be able to tell you off the top of their head. I could not tell you off the top of my head. I did look it up last night. I also have the protocol for hydroxychloroquine treatment. I still could not tell you off the top of my head. And this is the reason why. There is a protocol for prophylaxis. So basically, if you know that you've been exposed to someone that has active COVID-19, there is one way to dose with these drugs. I don't know what it is. I couldn't tell you off the top of my head. And again, that relies on you knowing that that person has active COVID-19. Now, how would you know that? If they're actively sick and coughing, you're obviously not going to get near that person. Chances are you don't know they're sick, and neither do they. They're telling you after the fact. And by that time, it's not a prophylaxis anymore. So now you're going from prophylaxis to, okay, well, now I'm symptomatic, or I'm starting to see the first signs of COVID, which often can be confused for other things. There are people that have confused early COVID for allergies, for the common cold, for a sinus infection. So then you have to go get a test, right? And see if you have active COVID-19 infection. So that's the second tier. And the dosing for ivermectin is different once you're actively sick. So you go from prophylaxis to early illness, if you can catch it that early. I'm willing to bet that most people don't catch their illness that early in the game. I think most people are solidly sick with COVID by the time they figure it out, by the time they've gotten the test results back, and they're already feeling crappy, they can't smell, they can't taste. So you have an active COVID-19 infection. And the treatment, I believe, does change once you're very active in it, from mild to moderate illness. It's very, very complicated. And the reason that I know this, like I said, I Googled the ivermectin protocol. Couldn't tell you off the top of my head. I have the protocol for hydroxychloroquine. I have it on a piece of paper. And when I first read it, when the doctor gave it to me last year, I was like, there's no way that I'm going to be able to memorize this. So I kept it. I have the two medications, because it's two medications with the HCQ protocol. It's HCQ and azithromycin. And I put the directions underneath the two medications on, on my shelf where I keep all my medications. And the reason I did that is because I know that if I become actively ill, if I lose those instructions, there is no way that I'm going to know how to dose this stuff. There's one protocol for prophylaxis. It's the same thing with hydroxychloroquine. There's one protocol for prophylaxis. So if I know that I was exposed to someone with active COVID-19, again, how would I even know that? And then it moves into a different protocol when you have a confirmed case of COVID-19. That is the complication, right? If I go up to someone and I ask them, what is the protocol for the Pfizer vaccine? I guarantee you a majority of the people in this country can tell you exactly what it is. You get one vaccine, 3 weeks later you get the second vaccine, and 2 weeks after that you have, full immunity, whatever that means, right? 80 to 90% immunity against COVID-19. We all know that because it's very simple. And that's the reason why vaccines are more effective and they're easier to dose and they're safer. I hate to say this, I hate to break the news to you, they are safer. And that moves me to my next point. Anybody that has gone through Lyme disease treatment, and by the way, these drugs do not treat Lyme disease. Lyme disease is a bacteria. There are co-infections. One is known as Babesia, that is a parasite, and it often accompanies Lyme disease. Ivermectin and hydroxychloroquine are both antiparasitics. That's why they are sometimes prescribed alongside, antibiotics for Lyme disease treatment. The issue is that it's kind of a long-term treatment, and even with these protocols, at least the protocol for hydroxychloroquine that my doctor gave me, you're not looking at one pill or two pills and you're good, or a week of pills and you're good. That's not what this is. I think a lot of people are mistaking ivermectin and hydroxychloroquine for a vaccine. A vaccine, like I said, you get your one shot, second shot 3 weeks later, and you're good for 8 months to maybe a year. We're barely getting that information right now. These pills are not a one-time or a two-time thing. It's a regimen that can last for weeks. You're talking weeks of side effects as well. And everybody reacts differently to this kind of medication. Most common side effects are diarrhea, nausea, vomiting, but there are also side effects that can happen with your eyes. I think blindness is one, or blurry vision or double vision, and that can last a long time if it doesn't damage your vision. And I'm not talking about the horse paste. I'm talking about the dosage for humans, for people. And this is what can happen with the human medications. I know people that have Lyme disease that have had to take these medications for a long time, and they said they had to stop because they were having visual problems and other side effects. Then you'll end up with dysbiosis, your GI tract is all messed up, and then you've got a whole host of other issues. Like I said, the vaccines are more than likely not going to do that to you. They might make you feel like crap for maybe a day or two, and then you get on with your life. So it baffles me when people jump on this bandwagon thinking that these drugs are safer and thinking that thinking that the vaccine is going to kill them in a couple of years, not knowing that these drugs can kill them now or can make them very, very sick for months, even after stopping the medication. It is not a vaccine. And here's the other thing, my third or fourth, fifth point. I don't even know how many points I've been making here. You have to take them every single time you're exposed to someone with COVID. It's not a one-time deal. You can use it as a prophylaxis, right? And that, I believe that can last for weeks from the protocol that I have. And like I said, I'm going off of my protocol for hydroxychloroquine. The protocol for ivermectin looked even more intense from what I saw. But every time you're exposed to someone, you have to do this regimen, the prophylactic regimen. Once you get sick with COVID, then you do the regimen for getting sick with COVID. if you are unlucky enough to get sick with COVID again, you have to do it again. You know, you're not just, you're not preventing anything. You're not stopping anything. You may be lessening the severity of COVID-19, but this is not a vaccine. You know, say you took it prophylactically, you didn't get sick. Well, maybe that person didn't have COVID, or maybe you didn't catch it. That still means that the next time you get exposed to someone with COVID, you have to do it again. Maybe you'll get sick that time. Maybe you won't get sick. If you don't get sick, then the next time you're exposed to someone with COVID, you have to do it again. Right? You know, you might think, oh, it worked last time and it kept me from getting sick. Or it might have been that you just didn't catch what they had. So that means that every single time you expose yourself to someone that possibly has COVID, or if you decide to go out to like a festival or something without wearing a mask, and you say, okay, well, I'll just take ivermectin beforehand or during this event and I should be fine. And it's like, well, yeah, you might be fine, but the next time you do it, you have to take ivermectin again. And these drugs are not drugs that you should be taking over and over and over again. That's why the vaccine exists, because it's 2 times and then you're good, or 3 times if you're immune deficient, you need that 3rd dose, you know, and then you might have a yearly booster, just like the flu vaccine. And that's what I want people to understand. This is not a safe drug. No drugs are safe. You know, for people that are railing against big pharma, it's a pharmaceutical. I don't know where people think that this drug is coming from. It's not, you know, appearing out of thin air. It's a pharmaceutical, and the doctors that are prescribing it are likely making money off of prescribing it. So you're not defeating big pharma. You're not sticking it to the man in any way. You're just making your own self sick if you're taking this. You know, these drugs are not, they were never meant to be taken just cause, or even as a prophylactic. They can mess you up. They can mess up your GI tract. Take it from someone who was on antibiotics for 6 months. You know, you can make yourself really sick off of this stuff. And so that's kind of what I want people to understand. You know, don't listen to celebrities that are, you know, dosing this stuff. I wouldn't believe it, especially a lot of these podcast hosts, you know, these radio talk show hosts. They're trying to bring an audience. You know, they're just like I'm doing here. This is the buzzword of the moment. Hopefully it'll bring a lot of people to this video, you know, and that's what a lot of these other people are doing. They're bringing people, they're bringing an audience, a specific audience, and they need that boost to their channel or to their podcast or whatever. And at the same time, people are being hospitalized. People are calling the poison control center because they're overdosing on this stuff. You know, it's not safe. You know, it isn't a safe thing. And if you don't want to get vaccinated, you have the alternative of wearing a mask. I'm sure there are N95 masks that are much more available now than they were last year. You know, those are the options. And for people that say masks don't work and all of that, then, you know, I don't know what to tell you. But, you know, these are simple things. That's why they are being advocated for. I don't even know if I used that word correctly. We're going to go with what's simple and easy. Ivermectin and hydroxychloroquine are not simple and easy to understand. You would have to memorize it. A doctor would have to give you a printout on how to dose these things. And even then, there is no guarantee that they're going to offer you protection. And my doctor was very, very clear on that. Even on the paper, if I get sick, I have to constantly monitor my oxygen levels. If I have the whole paper has all these very specific instructions, and it's very overwhelming. For me, it's easier to wear an N95 mask wherever I go because that's simple and easy. These things are not simple and easy. These things are very complicated, and they may not even work. You may feel a false sense of protection, or like you're just going to bounce back from this, and you may not. They may hinder you looking for better treatments or more treatments that have been better studied, maybe like monoclonal antibodies, which again, I don't know much about that either. It is experimental. You know, it doesn't have FDA approval either. But if you're taking these other drugs, you may think, oh, okay, I don't need to go to the hospital. I'm covered, and that's not how it works. And like I said, my doctor was very clear on that. I'd have to be monitoring my oxygen throughout treatment. And even then I may still have to go to the hospital. So I hope that I made this clear. If you insist on arguing with someone over the ivermectin thing, ask them to recite the regimen to you without looking it up on the internet. Because that, if they can memorize it, more power to them. And I highly recommend, if you believe in ivermectin and hydroxychloroquine, start memorizing that regimen, because once you're sick and once you're in that panic or feeling like garbage, you are not going to know what you're doing, even if you have these drugs on hand. So that's my rant for today. Please be very, very careful out there. Our cases are going up here in Los Angeles. I believe they're going up. And of course, Florida, Texas, places where people are not getting vaccinated. There are children that are ending up in the hospital as well. There are children that are dying, unfortunately. I highly encourage, if you are a healthy person, I encourage you to get vaccinated. These drugs, this is one of my last points that I almost forgot. These drugs, the hydroxychloroquine, the ivermectin, should be reserved for people that cannot get vaccinated due to illness or because the vaccine will not be effective for them. And people taking these and having them prescribed to them, people that are perfectly healthy that want these prescribed to them, you're taking it away from someone that cannot get vaccinated. They should be reserved for the most vulnerable people in our society. So, yeah, I do kind of take it personally when people think that this is just candy that should be handed out to everyone. We have a vaccine. We're one of the wealthiest countries in the world. If you don't want the vaccine and you're a perfectly healthy human, then, like I said, I don't know what to tell you. So, anyways, that's all I've got for today. I will try to get more videos up. I know I have like a backlog of videos that I haven't gotten up, but I really felt that this needed to be said. I was like bursting at the seams. So I hope this is helpful for some of you. I hope this relieves some tension, because I know I have been getting really aggravated with this debate, and I really want people to understand that it's not as simple as they think. So thank you so much, and I will see you again soon. Take care.